Well, it's Wellness Wednesday, and we're going to learn more about Ecmo. What is it? Joining us today to tell us more, to my immediate left, we have Anna Clayman, and she is Structural Heart Coordinator at Mercy Health St. Rita's, and to her left, Amanda Laird, Nurse Practitioner in Critical Care Medicine at Mercy Health. So thank you both for coming today. Good to see you. Us. Okay, so first of all, we hear Ecmo, but what is that? What does that mean?
Sure. So ECMO stands for extracorporeal membrane oxygenation. And what ECMO is it is an advanced life support technique that we can utilize. It essentially takes over the function of a patient's heart or lungs that are no longer effectively working for them. So the ECMO circuit circulates blood from outside of a patient's body through a circuit, adding oxygen and removing carbon dioxide, and is able to support the body's organs. So it's important for us to have this ECMO therapy because without ECMO, these patients wouldn't have that extra time that they need to recover, and they wouldn't be given that chance to recover.
Okay, so is it mainly just cardiac care then to use this, or do you use it in other ways too?
So ECMO can be used in cardiac care, but also in respiratory care. During COVID, we saw a big influx of something called ARDS, which is acute respiratory distress syndrome, and patients weren't able to use their lungs to effectively oxygenate or remove carbon dioxide from their body. So it can be used in either. We use it in the cardiac care a lot for patients after MI, so after a myocardial infarction or a heart attack. Patients sometimes don't have the support they need from their heart. Their heart muscle becomes weak, and we have to use the ECMO circuit to take that blood out, give it the oxygen that it needs, and give it back to the body. So we use it in both kind of modalities for patients to support them when their organs just aren't able to maintain what their body needs.
So is this a long time that you're on it, or is it a short period of time, or is it just, depends on the patient?
It depends on the patient, yeah. So generally, ECMO is considered a short-term therapy, usually days to weeks. Okay. So sometimes patients require longer-term ECMO, longer than days to weeks, if their course, of recovery needs to be a little bit slower, and that's okay. If patients need more of a definitive type of therapy, like maybe a heart or lung transplant, then that's a bridge to a heart or lung transplant that we can do.
Right, all right. So, I assume it takes special care for someone who's on this ECMO, and so what does that look like? How intensive is it for you guys?
So there's a team. It takes a team to manage these patients. The patients have usually 1-to-1 or 2-to-1 nursing care, so they have their own nurse, sometimes 2 nurses, depending on how sick they are. But that's just the start. It takes a team of structural heart, intervention cardiologists, cardiac surgeons, perfusionists, and then at the bedside, it takes respiratory therapists and physical therapists, occupational therapists, speech therapists. These people work with the patients through the whole process so that we don't lose strength and we don't lose the ability for them to make a full recovery. So it's a huge team, multidisciplinary. At St. Rita's, we take a lot of pride in making sure that these patients get that whole person and holistic care, that we don't miss any part of that. Even though they're in bed for sometimes, like Anna said, weeks to months, we don't want them to lose their ability to talk afterwards or lose their strength in their legs. So it's a multidisciplinary team. It takes a huge team to support these patients, and I think we do a great job.
All right, so it sounds like a lot. And can people learn more? Can you tell us more about the ECMO program?
Yeah, absolutely. So we're very proud of the program that we've built here at St. Rita's. So, like she said, we have a complex team, a multidisciplinary team of individuals. And we're very proud of that. So we've been able to have a lot of academic achievements as well. We've been published in multiple medical journals, case reports. We've actually published a chapter in an ECMO book discussing evolving therapy strategies. So we're very proud of that. And at St. Rita's, we've had 58 patients since the start of our program in 2021 that we've been able to support. So yeah, we're very proud of what we've done.
It sounds like it's a needed program too. Yeah. So for our area, really need to hear about this and how it works. So thank you very much for coming today, both of you.
Thank you so much.
Good to see you. All right, don't go away. First Edition continues in a moment.